The following is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
We've come a long way in the treatment of heart disease, but there's still a long way to go. Heart disease is still the #1 killer of men and women in this country. Welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. Today we are talking about your ticker, ways to prevent disease, reverse disease, and stay heart healthy. If you have heart health questions, give us a call now. Your questions may be answered here live on our program by our experts. The experts answering your questions are Doctors Ashley Lewis and Ben Walker, cardiologists with North Carolina Heart and Vascular. To call us here at Rex on Call, just dial the number on your screen in Wake County, 919-744-3876, and outside of Wake County, toll free, 877-277-6252. If you're watching us as we're streaming live on WRAL.com, email us your questions at rexoncall@rexhealth.com. You can even find us on Twitter. Send us a message at RexHealthcare, hashtag Rex on Call. That was a mouthful. Now, one of the most common excuses people give about not getting a checkup is, I just don't have time to go to the doctor. But Rex is making it easy. There's a quick assessment to help measure your risk of cardiovascular disease. Take a look.
I take him everywhere, but...
It took just 7 minutes to put this couple on the path to a healthier life.
I was surprised at how much in-depth information I got as a result of the assessment and the screening.
Rex Hospital's free online risk assessment is called HeartAware. The motto, 7 minutes online could save your heart.
The assessment is going to let the person know if they're at risk for heart disease.
Heart and Vascular Services Coordinator Rose Langley says anyone with a family history of heart disease, chest pain, or who takes medication should log on. And it's easy. Just answer a few simple questions like age and gender.
It'll also ask how much you exercise, if you've been a past smoker, what type of medications, what your lipid numbers are, your cholesterol, your HDL, your LDL, if you're diabetic.
After the assessment, you get a customized report, and if you're at risk,
we'll give them a call and offer them a screening, and it is free of charge.
That call is what brought Carrie Daly to Rex Hospital. She was encouraged to come in for a screening after her online assessment. She just happened to suggest her husband also get a screening.
That means my heart is not beating beat slowly, and sometimes it skips a beat.
Mamadou Niang knew he had this heart condition. What he didn't know
is also getting worse. And something has to be done to help the heart to function better.
He also knew he had asthma, but the screening also revealed
that I have less oxygen in my lungs than normally for a person of my age.
He now sees a Rex cardiologist and pulmonologist.
So he's put you on medication and he's just going to follow you up with
Yes.
that?
Clinical coordinator Sharon Wirtz gave Mamadou the initial ultrasound.
We look at the heart for the function when we do the screenings. We look to see the squeeze of the heart.
The experience has been a lifestyle changer for the couple.
I think our lifestyle has changed in the way we eat, also the amount of physical activity.
Mamadou is now on medication to open his lungs and strengthens his heart. He walks 5 miles a day.
And honestly, I feel better.
And that journey began after the 7-minute Rex HeartAware assessment.
The information given was given in language that I think anyone can understand, so I would encourage everyone to take it.
Now here's another incentive to get heart healthy. Rex has partnered with Moe's Southwest Grill. If you participate in Rex free HeartAware assessment during the month of February, you get $3 in Moe's Bucks. So log on and find out if you are heart healthy. Joining us now are Doctors Ashley Lewis and Ben Walker, the cardiologists with North Carolina Heart and Vascular. Thank you so much for being here, guys. We're already getting a lot of questions coming in, so let's get right to it. Please explain the difference between mitral valve prolapse and mitral valve regurgitation.
So mitral valve prolapse causes mitral regurgitation. And mitral regurgitation is a leaky heart valve. We all have 4 heart valves, and the mitral valve is one of the valves. Mitral valve prolapse, if you have it, is something that needs to be followed closely because the leakiness of the valve can progress over time and sometimes require repair of the valve.
Okay, and last year, big news was the decision was made to change the guidelines regarding prescribing statins and who can get those. And what have you been seeing of the last year as a result of that?
Sure, there's been a pretty big transition. Before we focused so much on people's numbers for their cholesterol panel, and patients have been wonderful with that. They know their numbers by heart, but the newer guidelines actually look at risk profiles and what different things they have, and there's 4 of them. One is actually a risk score, which you can use our online awareness program for. The other one is an LDL, which is a bad cholesterol greater than 190. The other one is if you have blockages in any artery, your neck arteries, your heart arteries, or your leg arteries. And the final one is diabetes. So if you have any of those 4, it is recommended to be on a cholesterol-lowering medicine, and the statins have been proven to lower mortality and other heart events.
We actually got a question in from Marshall in Raleigh. He's wondering what the concern is. Should there be concern on being on statin drugs for extended periods of time?
Yeah, and I think that's an interesting question to bring up. We don't know. Obviously, there's a lot of broadness to the new guidelines, and so a lot more people may be on them. I think it's a lot of it a patient and provider discussion, where if you feel like there's some pros and cons, and I think a lot of us are flexible to see the other different statins, and one may not be right for you, but another new medication may be. So I think just trying it with the providers.
Okay, Dr. Lewis. A 50-year-old male from Raleigh diagnosed with bicuspid valve 2 years ago. He wants to know if there's anything he should be doing to help his condition. First of all, what is bicuspid valve?
So a bicuspid aortic valve is where normally we have 3 leaflets to the aortic valve, and a bicuspid valve is 2 leaflets. And you're born with that. Usually, though, it's not diagnosed till usually in the 30s or so by heart murmur. Unfortunately, there's not anything you can do to prevent it or keep it from progressing. Just the normal things we recommend are obviously exercising, watch your diet, and then make a relationship with a cardiologist who can follow it closely.
Is there a surgery or something like that that could help?
Usually around the age of actually 50 to some 60, patients end up needing an aortic valve replacement. So they need a new heart valve.
Okay. Talk to us about just genetics. There's a lot we can do with diet and exercise, but there are some people, and those people are in my family, that just doesn't matter what you do, you are going to, have high blood pressure and high cholesterol, those sorts of things. Talk to us a little bit about that.
Sure. So I think if you think about all of our risk factors, there's things we can change and things we cannot change. So who our parents are and our genetics, we can't change. And sometimes that's wonderful things. Sometimes they do pass on diseases too. The things we can change would be our exercise, so decreasing our sedentary activity and being more active. Even on this show, we're all sitting right now, which you should be getting up.
We should get on treadmills right now.
That's
right.
Go,
Let's everybody.
And everybody at home, just getting up and walking.
Yeah.
And just
start doing squats, guys.
That's right.
Yeah.
Likewise, blood pressure, other modifications, and then a lot of diet changes are up and coming. And that's another thing we all can change too, is how much food we take in and try to moderate that.
Okay, drop and give me 20 right now. That's right. I'm not even kidding.
So during the commercial break.
Yeah, during the commercial break, we're all going to be doing squats. Now how much should somebody, if somebody's brand new, has not ever exercised before, how much do you recommend they get their heart rate up?
Well, the recommendations for exercise for the general population is 30 minutes a day, most days of the week, which really we equate to about 5 days a week of moderate intensity exercise. So that includes brisk walking, biking, swimming, actually yard work, and housework.
Ooh,
yes.
Nailing it then.
Yes.
Yeah, I got it.
So.
And talk to us, diet is such a big deal, and there's always, there's these trends of the paleo diet and all the, high whole wheat and high carb and low carb, and what's your viewpoint on how we should be eating?
I think a simple equation is you got to burn off more than you take in, and that's number one. But number two is that there's some of us that have certain addictions to certain type of foods, and I'm one that loves sugar and I love bread. Yeah, and I've found that by decreasing those amount of foods, particularly the carbohydrates, and a lot of actually things like wheat actually increase your blood sugar a lot higher than other things, such as even candy bars. So cutting back on some of those things can actually help decrease your caloric intake and make you feel a lot better too.
So something to talk about with your doctor for sure.
Sure.
Okay, awesome. We're back after the break to answer your questions. Give us a call or send us an email. That number is there on your screen. We'll be right back. Welcome back. This is Rex on Call live on WRAL. Today we're answering your questions on wellness and heart health. Right now we have a question from Sally. She had a medically induced stress test and it shows a apical. Yeah, we're going to let the doctors read this. Sorry about that, Sally. And does that mean she could have had a heart attack and not have known it?
So this is a common finding when you do stress test. The whole idea is to look for any type of bad blood flow, or we call it perfusion, where you're not getting it there. It could be that she could have had some scar, but sometimes our bodies move in the stress test, so it could be artifact too. So a lot of times this is a clinical decision about talking about their symptoms and visiting with their heart doctor about these findings.
And here's an interesting fact. Now, their heart attack signs are different in men and women. And now, while two heart attacks they're not alike, these are the heart attack signs mostly in men. It feels like chest pain, like an elephant sitting on your chest, rapid or irregular heartbeat, shortness of breath, dizziness, like you may pass out, or and stomach discomfort, like indigestion. Take a look at, for women, what you might feel. Pressure or pain in the center of your chest that lasts more than a few minutes, pain or discomfort in both arms, neck, jaw or stomach, shortness of breath without chest discomfort, and a cold sweat, kind of a nausea and lightheadedness. Now, the fact, because we always heard that like your left arm would feel, you'd get pain, but for women, it can happen anywhere.
It can go to the right arm, it can go into the jaw, it can actually present just in the stomach, or the presenting symptom could just be shortness of breath, have no pain in the chest whatsoever.
So how, if I get a stomach ache, why should I not freak out and think that I am having a heart attack? I mean,
Yeah, great question,
right.
Because that's obviously more common.
Right.
And I would say if you're having abdominal pain that's becoming worse and worse, and also maybe you do have some shortness of breath or fatigue when you tried to exercise, that's definitely something I would talk to your primary care physician about, or your cardiologist.
Because as women, we tend to ignore those and take care of the other people first.
Exactly.
Yeah, but those are symptoms we shouldn't ignore. Okay, back to these questions. Howard from Cary, eggs and cholesterol, what's the update? So I think Howard wants to know if he can have eggs yet.
Yeah, there's no limitations, and I think the cholesterol ends up being cholesterol neutral, so there's not, versus fried foods and fatty foods, there's some negative effects, but eggs are generally considered cholesterol neutral, so no positive or negatives to it, but most people like them a lot.
Yeah, and in moderation, right? Like, don't have a dozen every morning. Linda from Fayetteville, she's 67. In June of last year, she was diagnosed with
It's called Takotsubo.
Takotsubo. She doesn't know what caused it.
Yes.
What is Takotsubo? Sounds like a storm.
So I'll take it. So what Takotsubo syndrome is apical ballooning of the heart. Usually it's more common in women, and it tends to occur after some type of traumatic or stressful event, actually. And it's very similar to a heart attack in that you see wall motion abnormalities, which is basically areas of the heart that are not moving, but they do not have blockages in their heart arteries. And the other good thing, if you have had Takotsubo syndrome, is usually the squeeze of the heart improves.
Really?
Yeah, about 50% of the time.
So long term, she should be okay.
Mm-hmm.
They just need to do a follow-up ultrasound, and a lot of the recovery happens for most people.
Okay. Sarah was diagnosed with a heart murmur. Is there a cure for a heart murmur?
So we see a lot of people for heart murmurs, and sometimes they're very innocent, and the murmurs typically are caused by the valves in the heart, which are kind of like doors from one room to the other. Sometimes the door won't open all the way, so it's a narrow door, sometimes it won't shut, and there's a leakiness to it. So if they're not having symptoms, I'd say visit with the primary care doctor, have them listen to it, and then sometimes they may need an ultrasound to diagnose exactly what the cause of the sound is.
Okay. Carol has called, are heart palpitations, do we consider those the same as a heart murmur?
They're different. They're typically fluttering in the chest, and sometimes they could be nothing at all, sometimes not even the heart, but sometimes they could be an electrical abnormality, so a short circuit, and typically we have people wear heart monitors to determine that.
Okay. Darlene from Rocky Mount, triple bypass 12 years ago, has high blood pressure despite her effort. Then it will drop low. Will she need another surgery at some point, do you think?
No, blood pressure, high blood pressure and coronary artery disease are definitely related, but just because she's having some highs and then lows does not necessarily mean that she'll ever need surgery again. I have a lot of female patients actually who have very labile blood pressure, and labile means they have highs and they have lows, and these patients can be actually pretty difficult to manage because you obviously want to prevent the high blood pressures, but lows make you feel terrible.
Right.
Fatigued, lightheaded, dizzy.
Yeah.
So that's definitely a common problem, but difficult to manage. So, but she doesn't need to worry about needing heart surgery again.
Just stay in touch with her cardiologist.
Exactly.
Okay. Coming up, we'll answer more of your questions in Wake County. Give us a call at 919-744-3876. Outside of Wake County, toll free 877-277-6252. Email us your questions at rexoncall@rexhealth.com. Okay, welcome back to Rex on Call here live on WRAL. Just going through all these questions. To reach us here, call 919-744-3876 in Wake County. Outside of Wake County, toll free 877-277-6252. Email us your questions to rexoncall@rexhealth.com. As we're taking questions on heart health, let you know construction is underway for the new North Carolina Heart and Vascular Hospital at Rex. The facility is set to open in less than 2 years. We're getting really anxious nods over here, very excited, and it's going to have lots of bells and whistles. You have to see it, and we'll keep you updated on that. On to the questions. Here's Judy from Wilson. She's 62, chronic hypertension since her 40s, and her blood pressure fluctuates. How should she be incorporating exercise gradually?
So there's a couple different ways. One is to, the age is 220 minus your age is your maximum heart rate, and you want about 70% of that if you like numbers. The other easy way is if you can't talk to someone in a complete sentence, it means you're doing it too hard. So cut back. If you need to be able to tell someone, I'm not doing well, I'm in need help. So when you exercise on the treadmill, be able to still talk to someone in a whole sentence, and it's still okay to exercise.
And doing all those jumping jacks during the commercial break, you're still talking.
That's
more.
right.
That's
right.
Okay, question from Raleigh. Atrial flutter, had an ablation and cardioversion. Why do I have to take? There's a lot of propafenone for the rest of my life. She thought the ablation would have fixed it.
So atrial flutter and another arrhythmia called atrial fibrillation can definitely be recurrent. Now, if she had an atrial flutter ablation, the chance of recurrence is actually very, very low for atrial flutter. However, like I said, patients who have atrial flutter can get atrial fibrillation, and a lot of times patients have both. So my guess is the propafenone is being used to prevent atrial fibrillation in her, which can be very difficult to manage.
Okay, Vicki from Smithfield wants to know, she has severe shortness of breath. She wants to know what causes it other than, is it a lung issue or a heart issue?
Yeah, we see a lot of patients for shortness of breath, and it's pretty a broad spectrum. It could be something as simple as that people are deconditioned and aren't exercising and doing jumping jacks during our commercial breaks,
as you should be.
Or it could be something as well. It could be a heart-related problem too. So we normally start looking at the heart, looking at the lungs, and also checking something simple like your blood counts to make sure you're not having anemia. And then it always can be, when we're carrying extra weight, I kind of like the book bag theory of life. If you make us go on the set with 20 or 30 pounds of a book bag, we're all going to be short of breath too. So visiting with your primary care doctor is a good place to start, and just from there start ruling out each of the processes that it could be.
Okay, Ricky from Spring Lake wants to know exactly what type of exercise do you need to do to strengthen your heart? I mean, we talked about...
Yeah, we touched on that before. Essentially, you don't need to necessarily do a lot. Brisk walking, jogging, swimming, biking.
Does strength training help?
I would do low weights.
Low weights.
Lots of low weights.
Okay. Linda from Goldsboro, there's a tightness in her chest when she does some hard work. Every now and again, she gets the pain in the center of her chest when she's doing something. Is that something she needs to be?
Yeah, those are concerning symptoms for the heart, and that would move towards evaluation with a primary care doctor or a heart doctor.
Yeah, do that right away. Okay, Linda? Okay, Helen, how do you get tested for heart disease? She feels a pain every now and then when she does something strenuous. That's 2 in a row.
Yeah, so the way we diagnose heart disease is by actually having you exercise on a treadmill in front of us.
The stress test, right?
Stress test, yes. So I would definitely say she needs a stress test to have that evaluated.
Okay, get that scheduled. Sandy from Durham, diagnosed with
CHF.
CHF, what does that mean?
So CHF stands for congestive heart failure.
Oh, okay, okay. And 2 years ago, she quit smoking, but what else could she do besides quitting smoking?
So there's 2 different types of heart failure. One is where the heart is not pumping very strongly, so it's a weak heart. And the other one is where the heart pumps but can't relax open very well. So it kind of depends on which one she has, but good medicines and then obviously being active helps out too. and then close follow-up, watching her weights and watching her salt intake are all very important.
And congratulations on quitting smoking. Yes. And we want you to know about the Mended Hearts program at Rex Hospital. It's one of the only ones in our area. It's called Mended Hearts, and it happens the third Monday of every month at Rex Hospital. The group hears from area's leading authorities on cardiovascular care and treatment. Patients and their families learn how to fight cardiovascular disease and improve their lives. For more information, call 919-784-3756. We're going to have a final round of your questions after this break. Stay with us. This is Rex on Call. Welcome back to the show. This is Rex on Call, and we're taking a final round of your questions right now. Let's get to it. So this is William. He had a recent stent last Wednesday, actually. Does dizziness, tiredness last a long time, or is that normal?
I would say that's actually not necessarily typical after having a stent, unless he'd been in the hospital for a while. You know, being in the hospital, you just get deconditioned, you're laying in the hospital bed. But that should not last very long. So I would say if that continues for the next few days, he should probably be in touch with his cardiologist or whoever put the stent in.
Okay, this is Emmett from Clinton, cholesterol medicine questions. He gets really sore. One of the side effects of those cholesterol medications, he's getting really sore in his joints, and and he seems like he's tried Crestor, Zetia, Lipitor, and statins, but can't find one that doesn't make him feel bad in his joints. Is that something he just has to put up with, or is there something else out there for him?
Yeah, I think there's two different philosophies. One could be he could try one of the more generic ones, which is good old Pravastatin, which is $4 a month instead of the branded ones. And then only try it maybe once a week or once or twice a week, and do that in concert with talking with his prescriber. Don't obviously take our advice from a clinic visit. But at the same time, also consider doing the newer medication called Livalo, which doesn't work through the same pathway of the liver and is less likely to cause some of these side effects. It's a newer medicine, and some people do really well with it.
My mom actually switched that one, and they lowered her dosage, and that joint pain actually cleared up quite nicely.
There's also actually one more. Fluvastatin is one that usually doesn't cause as many side effects too. That's an older one.
Fluvastatin? Okay, so check those out with your doctor. Okay, David wants to know why some cardiologists prescribe Plavix for only a short period of time and other cardiologists prescribe Plavix for many years.
Yeah, this is a complex question. If you've had a stent in, the current guidelines, if you have a metal stent, is you can have Plavix for 1 month. So people that have upcoming surgeries, if they needed a stent, that's a lot of times what they use the Plavix for. The drug stents in the United States, we're supposed to keep Plavix on for 1 year. There are more complexities. If you have multiple stents, typically we like the blood thinners to be around because you don't want anything to happen to those stents. And that's very individual between each cardiologist and basically how they feel about how they feel about your clinical conditions.
Yeah. This question's from Wake Forest. Had a stroke 5 years ago and a heart attack 4 years ago. She's constantly tired. Is that due to the two events, or is there something she can do to get her energy back up?
It depends. If her heart attack unfortunately caused her heart to be weak, and she's now developed congestive heart failure, a lot of patients have fatigue with exertion due to congestive heart failure. I don't know the context of her situation, but it could be related.
It could be related. Okay.
Yes.
As always, consult with your physician about any health concerns. Thank you guys for coming in and answering all these questions. And thank you to the phone bank. They're still busy over there answering questions. And if you want any referrals and looking for a doctor beyond today's show or contact, you can call the Rex Health Net, which is free telephone information service. That number is there on your screen. Thank you for joining us. This is Rex on Call.